Hi, my name is Cheyenne, and for the second EHR case study, I chose the 40-year-old one female American Indian, Jacy Sky Redbird. So, upon reading this EHR, it looks like she was admitted to the medical surgical unit after being diagnosed with acute pancreatitis in the ER. Doctors were able to suspect that this pancreatitis was a result of some of the other medications that she was taking, and it was deemed that from that new medication she was taking, this was a side effect of that medication. Jacy did come into the ER. She was complaining of nausea and vomiting and diarrhea for the last 5 days, along with a decreased appetite and along with abdominal pain. Upon further reading, the patient did end up getting discharged and all was well. They just told her to come back if things were to change. But just some good things to know here, that the patient works as a nurse at the employee health at Chesapeake Oil and Gas, and she is heavily involved in the Cherokee Indian tribal events. Mentioned that her grandmother was a Cherokee Indian healer and that she gives her teas and topicals to help with her diseases that she does have. And then just a couple things requested here from the other healthcare staff is they did mention if we could give her some more information regarding a diet maybe, and how that would look like. And you can tell from it the client was a little unhesitant because she was unsure if she would be able to stick to it. She was unsure if she was going to do a good job because she said she does love chocolate. Incorporate cultural competency and health equity for Jacy here. I think the best thing here that needs to be considered is that Jacy does like to use traditional medicine. On our end as healthcare professionals, the way we could start to look into more of this is finding out more information about what type of medication she likes to use that are Cherokee traditional medicine. Look on forums or blogs, or we can just even listen to the patients themselves and see what helps them and what doesn't help them. And from there, she did mention that her grandmother was a Cherokee Indian healer, and maybe one of these days we could bring her in, and if she's willing to talk about it, show some respect, we could ask her questions about these medications, specifically what's in it, to determine if it is safe for Jacy, and make sure it doesn't coincide with her other medications that she is taking. And if the patient does wish to choose that route of using the traditional medication, we can ask either both the patient or the grandmother and let them know what kind of barriers or challenges do they face trying to get these medications. Are they hard to get? And then if so, maybe us as providers, we can try to find out what local resources would be best so they could attain these salves and balms used for their tea and for their topical salves. Including the cultural competence and health equity for Jacy here, I think it would be most beneficial to her, and then it would respect her culture,